Hi, I'm Dr. Julie Steinauer. I have a really cool amount of information to talk to you today about a new treatment called cooling the brain. It's also called therapeutic hypothermia. So if you want to go Google those two things, you can Google the cooling the brain or therapeutic hypothermia. And this is a treatment that is now being talked about and looked at pretty seriously for concussions. But here's what it's been treating in the past. So patients who've gone into a coma from maybe a traumatic brain injury, patients who've been introduced to and had exposure to chemicals, also in cardiac arrest patients, which I didn't know about. And then fifthly, it looks like it's also being utilized with infants who are born hypoxic or having gone through an ischemic situation where there's a potential for brain damage. This hypothermia treatment or cooling of the brain treatment sounds like it needs to occur within a specific time frame though. Within about 4 hours of the window of the incident occurring is best apparently for this type of treatment. And the other thing is that the temperature is super important. So a little cooling off is great, too much cooling off, not so good. So around 91.4 is what they're looking at is the maximally beneficial temperature for this therapy. But if you go just a few degrees less than that, well then you actually induce more problems and cause some issues within the brain that are super detrimental. So now what does this do? It decreases the problems with blood flow, so the damage to blood vessels within the brain can be decreased. It decreases the release of free radicals, which free radicals are just molecules that kind of are very destructive in cells and destructive to tissue. And then it also decreases the potential for cell death or necrosis of tissue within the brain, which is phenomenal because so if you've got an area of the brain that suddenly goes without a blood supply because of some sort of an incident, and then it goes without that blood supply for a length of time, you're going to have cell or tissue death or necrosis. But if you can stop that or slow that down, then what a phenomenal thing this is. So this is really promising research. Sounds like it's been used in a lot of different things before, but now we're looking at it associated with concussions. I think I've covered everything that I wanted to cover, but if you want to research this one, there certainly is a lot of information out there. Just go Google it. Go Google therapeutic hypothermia or cooling of the brain, and there's some really interesting information out there about it. Now, we work a lot with patients who have concussions or who've had traumatic brain injury. And so if you're local to us and you know someone or you are that person who's experienced that, even if it's from a stroke or whatever, then contact our clinic, 618-288-1489, and we'll be happy to talk with you about how we can help you. But you can also go to our website. Specifically, if you're not local to us and you don't want to give us a call, go to our website at visionforlifeworks.com. There's a questionnaire on there. You can fill that out. That's going to kick over to us and we'll connect with you and talk to you about how we might be able to help you. And then if you're a doctor who's a doctor of optometry and you do developmental vision stuff and maybe you follow us and you follow us on our YouTube channel, then you might be interested in our Next Level coaching on Facebook. So it's Next Level Vision Therapy. And that's a great little group that we have where we do some training on how to have amazing practices. Or maybe you're looking at, hey, I really need to have even further help with this, and I'd love to have individualized coaching for my business to take my business to the next level. Well, then contact us. All that stuff's on our website, so you can kind of look at it there, and we will help you double, triple, or quadruple the size of your business within just a couple of months. Thanks for tuning in.